Hey guys, Jordi again from Dear John. I just want to follow up with you that, I just snuck away from my cabana. But the holiday seasons are here and travel is happening. So grab your flip-flops, grab your suntan lotion, and let's talk about travel. Hi guys, my name is Jordi, and welcome to Dear John. This is a series where I'm going to answer your questions about lymphedema, lipedema, and compression. Today's questions are all going to be centered on vacations. We're all getting ready to get out there, get in the fun, the sand, maybe in the woods, but it's summer vacation time and we want to go ahead and enjoy it and manage your swelling as well. Let's get started. Today's first question is about a patient who's had mastectomy 22 years ago and has a little bit of swelling, and she's worried about flying on a plane because she's read that flying can cause swelling. Well, there's truth. The reason is that when you're 30,000 feet in the air, there's less air pressure, and that can cause swelling. It's why a lot of people feel the fullness in their legs. So what we want to do is we want to make sure that you're getting out there and getting the right compression. So if you'd have no compression sleeve at all, what I recommend is start with a 15-20, and maybe even a gauntlet, something that covers the hand and the thumb, but not the fingers. But what you're looking for is a lightweight sleeve that's going to be able to do the compression that you need and prevent any types of swelling. I'm a big fan of prophylactic sleeves. I think that they can do great things for you. It's why I wear prophylactic compression. So a 15-20 is good for most patients, but make sure you've got somebody that's qualified measuring you at the wrist, the elbow, the armpit, and length, because those four measurements are going to dictate what sleeve you're going to wear. Now, what if you already have lymphedema? What should you do? Well, wear your sleeve flying. You should have sufficient compression in the garment you have. Now, if your garment is older than 6 months, certainly get it replaced. If you're really worried in what else can you do, if you want to go with Old Faithful, consider bandaging your arm. But that can be a little bit problematic on the flight. So, wear your compression, and back to the very first part of the question is, consider a prophylactic sleeve that will give you the compression and support you need while you're on flight. When you're off the flight, go ahead and take the sleeve off, tuck it in your purse. Next question. Patient says that they are going to go for an 8-hour drive and they want to limit their lymphedema issues on the car ride. What should they do? Well, important thing is make sure that you're wearing the right compression garment. Remember, you need it fitted right and it needs to be 6 months or less in age. That way you can make sure that it's going to fit you and it's going to do the proper job. But next, make sure you're getting out every couple hours. Many times people try and drive straight through, and that can cause a lot of problems. Partly because the garment will start to migrate downwards and bind at the ankle or at the knee. Partly it's going to be a problem because you're going to get sleepy on the drive. So do yourself a favor. Get out every couple hours, walk around a little bit, maybe get a bite to eat. When you're filling up with gas, make sure you walk around a little while. Get that blood moving and get that garment pushing up against the skin to drive the fluid back out. That's going to make some of the biggest differences for you. Next. The next patient says that they've had a DVT in the past and they want to know what they need to do with traveling risks. Well, first and foremost, if you've had a DVT, that stands for deep venous thrombosis. That would be a clot in the deep veins of the leg. So what you want to do is make sure that you are taking the prescribed medications specifically for you. So it's a blood thinner of some type. Could be aspirin, could be some other type of medication. Be sure that you're taking it as you should. Next, wear your compression garments. If you don't have any, ask your doctor about it. And the reason is this. Compression garments are going to keep blood from pooling or just staying stagnant in the legs. So if you are wearing a compression garment and it helps push that fluid and blood back up and assist the venous system, you're lower risk as well. So consider getting a lightweight compression garment or support socks if necessary. All right, folks, I want to say thanks for tuning in. I appreciate you giving me the time to be able to talk about lymphedema, lipedema, and compression. Now, June is Lipedema Awareness Month. We've gotten a lot of questions, and I want to make sure I give enough time to be able to get all the questions in. So don't forget to send in your questions, and you can go to the Juzo website and be able to submit them. And if I don't get to your questions on this video, that's okay. I will reach out to you personally, and I will answer them through emails. So turn in your questions, and I'll see you next month. Maybe even at the beach.